Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Alan Goldhamer with us. Dr. Goldhamer is an expert in the use of medically supervised water-only fasting. He's the founder and director of TrueNorth Health Center and has supervised the fasting and care of more than 25,000 patients. TrueNorth Health is a multidisciplinary practice that includes doctors of medicine, osteopathy, chiropractic, naturopathy, and psychology. Its healthcare providers treat patients with conditions ranging from high blood pressure to diabetes to autoimmune disorders and lymphoma. The center is the largest facility in the world specializing in medically supervised water-only fasting and a premier training facility for doctors to gain certification in the supervision of therapeutic fasting. Dr. Goldhamer is a frequent lecturer, author of several books, most recently Can Fasting Save Your Life, as well as numerous studies and case reports published in peer-reviewed journals. Welcome, Dr. Goldhamer. Thanks so much for joining.
Thank you for having me with you.
Yeah, absolutely. So I'd love to hear some of your backstory. How did you become an expert in fasting?
Well, I got started at a really young age. I was 16 years old and mostly worried about being a better basketball player. I read some books, including Herbert Shelton, who said that health was the result of healthful living,
Mhm.
that it involved diet, sleep, exercise. And he talked about fasting as a way of kind of undoing the consequences of dietary excess. And it made a lot of sense for me.
Right.
It didn't work. I was trying to be a better basketball player than Doug Lyle, who was my best friend. And unfortunately, he adopted the same kind of diet and lifestyle. And I'm 65, he still beats my butt every time we play. So it didn't work for the intended
For that
purpose, but
reason.
it did get me interested in this. I was also inspired by my uncle, who was a medical doctor, who said that when I mentioned I had an interest in pursuing alternative medicine, he said, no, no, nobody in this family would go to a doctor like that, let alone become a doctor like that. He said, better I should be a communist spy. And my
Said that.
father, yeah, my father took me aside. He said, son, I don't know anything about alternative medicine, but anything that makes him that angry and mad, it can't be bad. So you stick to your guns and good luck to you.
Wow. Okay. So that's an interesting introduction to it. So for our listeners who might be new to the health benefits of fasting, can you give us like a quick overview of maybe some of the primary mechanisms of how does this help?
Yeah. So fasting is kind of the complete abstinence of all substances except water. And we do it in an environment of rest to maximize fat and minimize lean tissue loss.
Mhm.
And there's actually a number of well-demonstrated mechanisms. One is weight loss. You know,
Yeah.
people that have extra weight also have what's called extra visceral fat.
Yeah.
So about 10% of excess fat is visceral fat. Visceral fat is uh, hypertrophic. It gives off inflammatory products. It contributes to heart disease, diabetes, cancer, autoimmune diseases. These diseases that are treated as if they're completely independent entities are actually all tied to the inflammation associated with visceral fat.
Mhm.
Even though you have to see different doctors to even be diagnosed, they're not all independent, unrelated conditions.
Right, right, right.
And fasting helps preferentially mobilize visceral fat. And
Mm.
so for a person that loses 10% of their body weight fasting for a couple of weeks, they would lose 20% of their fat and as much as 40% of their visceral fat.
Mm.
So visceral fat acts like a tumor and fasting acts like it does with tumors. So when you say you go on a fast and lose 10% of your body weight, you may lose 50% or 100% of your breast tumor, not necessarily linearly, because
Right,
the
right.
body's breaking things down in inverse order proportion to need. So
Sure.
detoxification is another potential mechanism of fasting. People, if you do a fat biopsy of people today, they have PCB, dioxin, pesticide residues, heavy metals. You'll find all kinds of stuff inside their cells. And fasting is able to allow the mobilization, elimination of those materials. In fact, it's so rapid, it can be quite uncomfortable. Your
Right, right, right.
mouth coats up and tastes like something crawls in there and dies. You have skin rashes. You have all kinds of
Wow.
unpleasant symptoms.
Right.
Yet the net total body load
Uh-huh.
drop is, in fact, it's so significant that some people say, don't do it. It's too dangerous unless you take their proprietary products. Then apparently it makes it safe.
Oh,
But
sure. Yeah.
the idea is this is a biological adaptation. All the humans that couldn't fast died
Mhm.
because from a bioevolutionary viewpoint, sometimes spring comes late. And
Yeah,
if you
yeah.
can't take this bulbous neuronal net we have, which is our biggest burner of glucose, and figure
Right.
out an alternative fuel source, humans could go about a week without fasting, like most other creatures.
Sure.
But the average 70-kilogram male can fast 70 days. Not that you should, but you
Right.
could, because
Right.
our brain converts to burning beta hydroxybutyric acid, essential fatty acid, rather than sugar. And that allows us to use our fat stores, and now we can fast. All we've done is taking this very ancient practice
Mm-hmm.
and applied it in a very modern situation. That's one where people are sick from dietary excess.
Mm-hmm. Yeah,
And so fasting is a useful way of rebooting the system. And then, of course, you still have to adopt a health promoting diet and lifestyle.
of course.
It's
Sure.
interesting that the Jews and the Jains, the Hindus, the Muslims, the Christians, and the Buddhists don't agree on everything, but they
But they
all
all
have a
agree on fast.
tradition about fasting because it changes how
Sure.
you feel about yourself and the world around you.
Yeah.
And so it's not just Moses, David, Elijah, and Jesus that fasted for 40 days, but our patients as well. In fact, I've had patients come and say, you fast your patients up to 40 days on water only. Do you also teach them to part the Red Sea? And I tell them it's all in the wrist, it's like,
Nice. So for the people that are struggling with the detox process, what do you guys, I mean, it's medically supervised. So do you have processes that you incorporate in order to help with that or to help with some of the Herxheimer reaction type die-off
yeah.
experience, or what does that look like?
Yeah. So our patients, first of all, you recognize not everybody's a candidate for fasting. So we're
Sure.
going through a history exam in lab, your standard evaluation to make sure first a person's a candidate. Second of all, they're in a controlled setting. They're seen twice a day by staff doctors. We're
Mhm.
using appropriate lab testing in order to monitor their physiological response to
Sure. Right.
fasting. And
Right.
they're most importantly in a resting state.
Mhm.
Because if you're more active in fasting, you'll lose more weight, but that weight won't be fat. It'll be lean tissue. So
Sure.
to minimize lean tissue loss and maximize fat loss and detoxification, we have to be in a resting state. We have
Mhm.
to be in a controlled setting. So you're not driving and going to work and carrying
Right.
on normal activities.
Right. Right. Right.
And then we're monitoring patients, as I said, twice a day, looking at vitals, looking at lab to make sure that they're staying in the fasting state and they don't progress into the starvation mode. Fasting is when you have labile reserves. Starvation happens if you deplete those reserves and then you die. So we don't do that because that would mess up our outcome data.
I would
So
imagine.
we're very careful about it. We've had 25,000 patients undergo medically supervised fasting in the last 40 years. And we've actually published a fasting safety study showing that this can be done safely and effectively if it's done according to protocol.
Yeah. And so why choose water only versus juice, medical food, something along those lines?
Mhm.
What's the
Well,
benefit?
medical foods and juice have tremendous advantages because you don't need the level of supervision.
Right.
They can be done safely and effectively. You don't have the dehydration concerns. You can use those in conjunction with conventional medications. And so
Mhm.
that is the dominant form of fasting that's done. And we do some modified fasting at TrueNorth as well. If a person's not a candidate for water-only fasting, we'll put
Mhm.
them on 600 calories of vegetable juice and broth and do modified version. But
Mhm.
when water fasting is appropriate,
Mhm.
it's more effective
Mhm.
than the modified fasting. It's dramatically faster and more effective. For example, if you're trying to break down a lymphoma tumor, you can put a person on months of juice fasting and not see the changes that we see in a few weeks of water fasting. If you're trying to normalize blood pressure, they're coming in 220 over 120 capped out on 5 meds. You will see a much more dramatic effect with water fasting than you would with modified fasting. For
Mhm.
people that are not candidates for water fasting, that's not an issue.
Sure.
If somebody doesn't want to water fast and they're willing to be patient,
Mhm.
many of these conditions will respond to modified fasting and dietary control. But sometimes it takes so long that now you've got people on medications for a longer period of time. They're having secondary effects. So rapidity is definitely an issue. Also, there's some things like taste neuroadaptation more powerful with fasting. If you're trying to get people to enjoy eating healthy foods, you put
Mhm.
them on a water fast. Now good foods taste good.
Yeah.
It takes
Okay.
longer to neuroadapt to a low sodium diet or a low fat diet on a feeding program than it does on a water fasting program.
Right. That makes sense.
So it's just a more intense version. And mostly the people we see are people they've tried the diets, they've done the modified fasting. Their condition is serious enough it's not responding. And I'll give you a great example of a paper we recently published.
Yeah.
Lipoprotein little a, as you know, is a cardiovascular risk marker for cardiovascular disease. Social Security only or Medicare only pay for one test because it's not changeable. No drug reduces it.
Oh,
Dietary change is of limited effect.
yeah.
But with fasting, we were able to demonstrate in one recent case report 40% reduction in lipoprotein little a after a 10-day water fast. Another patient, 5-day water fast, 100-point drop in lipoprotein little a. And now
Wow.
we're doing the case series. Water fasting reduces lipoprotein little a. Vegetarian diet, juice fasting don't have the same effect. So there's apparently mechanisms that are being kicked in water fasting that are more intense or more effective
Yeah.
than our modified programs. And it does make sense. For example, when you go on a water fast, there's dramatic increase in beta hydroxybutyric acid, which becomes the primary source of the brain fuel.
Mhm.
That is associated with increased BDNF. BDNF is the neurochemical associated with protecting the brain from oxidative damage. So
Mhm.
you're going to see a more profound rise in some of these biochemical changes than you would with a modified fast. Sometimes you don't need more profound changes. Do the
Mhm.
juice fast. That's
Sure.
great.
Yeah.
But if
Yeah.
you've done that and it's not enough, then sometimes we turn up the heat. Dr.
Right.
McDougall used to refer his patients with an apology. He would apologize to the patient. He would say, look, I'm so sorry, but your blood pressure is still too high. You got to go over to Goldhamer's and good luck to you, you know? Because he said we were the punishment for patients that didn't
Sure.
get well with diet alone, you
Well, I'm
know?
sure there are quite a few people who are like fasting. Oh my gosh, that's really
Oh,
intense.
yeah, particularly prolonged fasting seems kind of
Sure.
insane.
Yeah.
But again, we've been able to show with published safety studies it can be done safely and effectively according to this protocol. And
Yeah.
the book, Can Fasting Save Your Life, details the 22 papers we've published in the peer-reviewed literature that
Mhm.
show really dramatic effects. For example, with high blood pressure, we have the largest effect size that's ever been shown in treating hypertension in humans, with an average effect size of in stage 3 hypertension of over 60-point drop in systolic blood pressure. And
Wow.
that's not even taking into account they start medicated, they end up unmedicated.
Yeah,
We
yeah.
did a prospective study with our colleagues from the Mayo Clinic recently. It was just published, and it was 26 of the 27 people were able to completely normalize blood pressure without medication. More importantly, at 1 year follow-up, the majority were still normotensive without medication, and 76% had maintained their weight loss. So
Mhm.
it shows that at least highly motivated, self-selected people are capable of not only getting well, but they can stay
Okay,
well
well,
by doing
sure.
dangerous and radical things like eating well and exercising and going to bed on time and eliminating what in fact are some pretty serious medications, hypertensive medications, chronic cough, fatigue, impotence, and premature death. In
Right.
fact, the reason why they don't give everybody hypertensive meds because more people will die from the medication than will be saved by blood pressure unless your systolic blood pressure is raised high enough that the death risk from stroke exceeds the death risk from the medications.
Of benefit, sure, absolutely. So, and you've referenced lymphoma several times. So it sounds like that's kind of the cancer that responds best to this, or is there a broad spectrum of
Well,
cancer?
that's the cancer that you can publish
Oh, interesting.
because it's well accepted that chemotherapy does not reduce all-cause mortality from lymphoma. So
Uh,
it's not considered unethical to treat a lymphoma patient and get them well.
Interesting.
If it was a different condition, we wouldn't have published in the British Medical Journal if that same clinical result had been, say, breast cancer, because
Uh-huh.
there's an accepted standard
Of
practice of
care,
medicine. Whether it's effective or not is another issue. But if
right?
you step outside the standard of practice, the journals are not going to publish those results because it's considered unethical to encourage people to engage in behaviors that defer them from standard medical care. In the case of lymphoma, it was determined that because the conventional treatment is so notoriously ineffective, it was not unethical for us to help that patient get well. And then once we publish the case report, then it opens up the door and we published a case series. And
Uh-huh.
now we've had, in this case series that we recently published, not only did we have 3 year follow-ups on the original case, we had a patient who had failed chemotherapy
Uh,
and then responded to fasting. And then we had a stage 4 lymphoma with mets in the bones that also responded first to 21 days, and then we brought him back and did a 39-day fast. We
mhm.
did a 21-day fast initially because the oncologist was extremely vehemently opposed to
Oh,
fasting.
yeah.
But once they saw the follow-up CT scans, they said, oh, you got to go back and do more of that. And then
Well,
we
good for
did
them.
39 days and got dramatically more, and the patients continued to improve. So now we have a case series published. The
Sure.
next step is to do a clinical trial, which will divide people randomly in half. Half of them stay on conventional care and get sick and stay sick. Half
Yeah.
of them will come and do fasting and get well. And then over the long term, we look and see who's better, the people that get well or the people that stay sick. That may be a slight oversimplification, but
Sure. Yeah, yeah. No, absolutely.
no. So the point was because lymphoma was
Yeah.
unique in the regard that it was kind of accepted that treatment didn't work very well.
Right.
It
Yeah, yeah.
wasn't
Sure.
considered outrageous to do this. And now that we've shown that it's actually safe and effective, we can
Sure.
publish on that
Go
more
broader
effectively.
with that.
So
Yeah.
it's not that we aren't seeing having experience with other people. We're just
Yeah.
having trouble,
Getting it published.
demonstrating it.
Sure. No, that makes sense. And now it seems fairly well recognized that cancer is mostly a metabolic issue anyway. So is that
Well,
what?
certainly there's strong evidence that cancer
Sure.
is a metabolic disease. They talk
Right.
about the involvement rather than primarily DNA. more mitochondrial based. I don't know if that's accepted, but it's certainly more discussed.
Yeah.
And there's, some well-established authors that have published some books, and people are certainly talking about that.
Right. Yeah. And it certainly makes sense that anything that's going to be in the realm of the metabolic disease is going to respond very well to fasting, like diabetes, like cardiovascular. So tell us some of your favorite cardiovascular success stories. You talked about hypertension, but cardiovascular disease in general, perhaps.
Well, the as I said, for me, I like the fact we've got a study with 176 consecutive patients resolving their hypertension is pretty compelling
That is
evidence.
pretty
And a
compelling.
prospective study with
Yeah.
26 out of 27,
Yeah.
I think is compelling.
Sure.
I can tell you that one of our first patients, when we became a fully covered medical benefit for one of the big labor unions in California,
Hmm.
they made it so that anybody with diabetes or hypertension could come to our clinic.
Oh,
And when they
cool.
made it available, they sent the first patient over who was a hypertensive, 220 over 120, capped out on 5 meds, diabetic, uh, A1C of 10, and
Oh,
uh, 75 pounds overweight, kind of classic.
yeah.
And they sent him over, but they didn't tell him what the program was. And so, he kind of showed
No.
up and he said, wait a second. He was looking around our clinic and he said, no, I don't think this is a mistake. And I said, look, it's
Tough
not a
sell.
mistake. I got your name on the list, you're on the
Yeah.
list. He says, well, no, I don't think so. I said, you're here to get well. He goes, no, that's not me. I'm not sick. And I
Oh,
said, well, you are sick. You have hypertension, which is 220 over 120. You've got diabetes. You're carrying a keg around in your belly. I said, you're not only sick, you're at risk for dying. And
uh-huh.
he said, well, don't we all have to die? And, I mean, that's a valid point. I
True.
said, but, you're on $880 a month worth of medications. If we get you healthy, you won't need the drugs. He said, what do I care? I don't pay for the drugs. My union does.
Oh, wow.
So I'm thinking, oh my gosh, I'm going to strike out with my very first referral. And I'm thinking about, okay, diabetic, hypertensive, tons of meds, male, what do we know?
Hmm.
Yeah. So I said, if we get you healthy, we might be able to do something about your little problem.
Uh-huh.
And he stood up and I'm thinking, uh-oh, because this guy's a big guy. His
Uh-huh.
neck's bigger than my thigh. He says, well, why the hell didn't you just say so? And so, we got his attention.
Yeah.
We give him, we have to feed him though. He's a triple cheeseburger guy. He tells me he
Of
eats
course.
triple cheeseburgers, but if they put lettuce on it, he would take that off and throw it away because he doesn't eat rabbit food.
Oh my.
But we give him some food. He can't eat the food. He's trying to eat the food. He's like,
Yeah.
I'm thinking he's got an esophageal tumor. He can't swallow the food. I said, it looks like you're having trouble with the food. He says, what food? He said, this is not food. He
Oh,
said, this is disgusting. He said, if I had to eat tasteless swill like this, I'd rather just die. He says, why don't you go out to my truck? You get my 12 gauge. When I'm not looking, just shoot me in the head. So we check him in. He ends up fasting, um, loses 50 pounds and 26 days. He fasts 26 days. He loses 50 pounds. He's off his meds. And now he's actually able to eat the food. And so
uh-huh.
I'm sitting down with him. I said, it looks like you're doing better with the food now. He says,
Yeah.
yeah, your damn chef's finally getting the hang of it. I said, it's the same food. He says, no, the stuff you gave me when I came in was disgusting. He said, this is not bad. So 6 months later, I see him at a semi-annual. We're doing blood pressure screening for the year. I said, how you doing? He says, I'm doing just fine. So now I know what to talk to people about things they care about. So we had over
Exactly.
100 of those union members come through with
Yeah.
diabetes, hypertension.
Hmm.
And what I learned was that, what if you have a highly motivated patient, it doesn't matter how much they know, what their educational background is.
Right.
This makes sense to people. Health results from healthful living. It's diet, it's sleep, it's exercise. Fasting's a tool to kind of facilitate the process.
Along,
But
yeah.
it's hard. If I send him home with a diet sheet and say, eat a healthy diet, he wouldn't have lasted a meal.
Sure. Yeah.
But now after fasting, he could actually neuroadapt. He could eat
Right.
healthy foods.
Yeah.
We call it educated. It's really brainwashing. I mean, we're doing all this intense education while they're vulnerable during fasting. And
Sure.
so they develop the skills necessary to be able to make the diet and lifestyle changes. And for those people, it
Yeah.
works fabulously.
That's terrific because so many of the people that we as naturopaths see, they're already the people that have self-selected. They're the people that are highly motivated and they're willing to do all the stuff. And so those protocols work great. But as you say, there's a population where they're not there and you have to meet them where they're at with whatever their motivation point is. So it sounds like you've
Right.
probably gotten good at figuring out what people's motivation is
Oh,
likely to be.
what we do is we just take the credit. What happens is it's the doctors in the field that send us their most motivated patients. So many doctors maybe only have a handful of highly motivated patients, but they'll send those to us.
Yeah.
Then the patient does all the work, the body does all the healing, then we take credit for it. It's a
It worked out
great job.
perfect.
But in our practice, we have maybe 80 people there, but they're all somebody else's most motivated patients.
Yeah.
And then they're able to go back to that doctor and get ongoing support. So
Mhm.
we get all the credit and we have all the fun, but the doctor actually does all the
Does
work.
all the extra work, with the exception of when you get referrals from unions where you don't necessarily get the most motivated.
Well, that's why it's a lot harder. I'd rather have my naturopaths and medical doctor affiliate doctors referring because they kind of get the patient all
They work.
motivated and educated, and then they're
Sure.
able to provide ongoing support. When
Yeah.
we have union patients, what we have a telemedicine practice as well, where
Yeah.
we'll provide remote support to people that
Okay.
don't have the benefit of having a local doctor that can help them, and that does help make up for some of it.
Some of it.
Just people need so much support and education because they live in a world designed to make them fat, sick, and miserable, and
Yeah.
not to help them stay healthy or get healthy. And
Sure.
so there's a tremendous amount of motivation and effort that's needed to live in this world and still adopt health promoting habits.
Mhm. So back to the idea of cravings changing. How long does that typically take on average? Do you notice that people
Well,
say,
we know from the literature, it takes about 30 days on a healthy diet to adopt to a low salt diet, but it takes almost 90 days to adapt to a low fat diet to where
Mhm.
the satiation mechanisms keep it. With fasting, it's much quicker. We
Okay.
actually did a taste neuroadaptation study where we looked at minimum threshold of sugar and salt, and we're able to prove that within the context of short-term fasting, that actually changes.
Mhm.
Good foods start to taste good. And so it's days or weeks rather than weeks or months. And
Right.
it's hard to get people to comply with. If you say to a patient, look, I want you to eat this diet, it's going to taste like crap. You are going to hate it. It's disgusting, tasteless swill. But you
Uh-huh.
just keep eating it for 3 months and eventually
Right.
you'll get to like it.
Sure.
That's not going to happen.
Work.
But
Yeah.
if you can get a person through a fast and now foods start to taste good, oh, your chance of adherence is a lot better.
Sure, absolutely. And so you said days or weeks. So for some people, like maybe a 3 to 5 day fast might be enough for them to have their taste buds change.
Some people, even the intermittent fasting is enough to start the process of shifting the palate. So when they go on their Prolon or they do their juices, they start to notice changes. Certainly in that 3 to 5 to 10 day water fast, you're going to see significant changes. Now there are some people it takes longer,
Mm-hmm.
and there's biological differences between people and also different degrees of addiction.
Sure.
It's
Yeah.
like how long does it quit? Think about smoking. When
Hmm.
people go on fasting, smoking, by the second or third day, there's no more biological cravings.
Right.
So it's way quicker than feeding, where it might go on for weeks.
Right. Yeah.
Um, and so for most of our smokers, they're shocked at how easy it is to quit compared to how hard it was when they were free living. Same
Mm-hmm.
thing with alcohol. Alcoholics go through a much more rapid detoxification process in fasting.
Mm-hmm.
But it does vary. There are some people that are quicker and easier than others.
Mhm. So the people who come to you, you've mentioned the 40-day fast several times. What kind of variation do you have? Is it, I assume it's patient specific to say how long would be appropriate based on what you have
Oh,
going
yeah,
on or all of
absolutely.
that. Okay.
So it's going to range anywhere from 5 to 40 days. And if 40 days is only 1 or 2% of the population, most of the fasts are between 1 and 3 weeks.
Got it. Okay.
So typical patients, they would say you have a hypertensive patient on a diuretic medication. Their blood pressure is 160 over 110. They're on a one or two medications. That person, you're going to have a few days to wean them off their medications. They're going to fast for a couple of weeks on average, maybe as much as 3 weeks, and they'll recover. It takes half the length of the fast to recover. So that patient might be with us a month or might be with us 3 weeks.
Mhm.
Somebody that has, follicular lymphoma might be with us 6 weeks, depending on how significant the problem is. A lot of
Right.
it depends on how long does it take them to get off their meds, because you don't fast people on medication. So you
Yeah.
have to wean them off their medication first. Now,
Mhm.
fortunately for blood pressure, for diabetes, just changing the diet, I mean, you start seeing
Mhm.
rapid changes.
Right.
And for
Absolutely.
a lot of our patients, it's just they have a persistent enough problem. They've been working with a naturopath, and most of them just get well just doing outpatient care. But once in a while, somebody has a more persistent problem. and
Mhm.
then they'll send them in and we'll do the fasting to kind of knock the rest of it out.
Jumpstart the rest of it. Absolutely. And so you mentioned that fasting isn't appropriate for everybody. So what are some of the contraindications for a medically supervised fast, like with?
Sure. Well, clearly, people that are pregnant or lactating are not going to want to fast. You fast when you're lactating, you're going to lose your milk production. If you have anorexia nervosa, you may want to fast, but that's not going to be a good thing. If
Obviously.
you have cardiac instability, you have atrial fibrillation, you've had a recent PE, myocardial infarction, anything that has you in anticoagulant therapy, you wouldn't just discontinue that
Or of course.
because you could throw a PE or have a stroke. And you don't fast on those medications because medications can become greatly potentiated during fasting. So even things you might be able to get away with feeding, you wouldn't do water fasting, including herbs and supplements and other things that would normally be tolerated in the feeding state, may not be at all tolerated in the fasting state. If a person has kidney dysfunction where their creatinine is over 2.0, we're not going to do water fasting because the kidneys are an essential part of the detoxification process. If you
Yeah.
have too much kidney dysfunction, you would overload that situation and you create bad outcome data.
Mhm.
If you have people that are on medications that you can't safely withdraw, if they're on high dose steroids or whatever, you can't just stop the steroids and then start the fast. You have to wean them down. Even neuropsych meds, you gotta be careful as you wean those down. You can eventually get people stable and off of them.
Mhm.
As they talk about in the anatomy of an epidemic, these serotonin uptake inhibitors deactivate the D2 receptors in the brain. And then when they try to get off them, you get acute anxiety and depression because
Sure.
you're addicted to that response. So you have to do that gradually.
Right.
So there's a lot of people that are not great candidates for fasting. And that's why we offer consultative services where people can, without any cost, go on, fill out their forms, we'll review their medical history, talk to them about is this even appropriate for them? And if
Sure.
so, point them in the direction of a doctor that can be of help to them
Right.
in
Yeah.
making that transition. So this is a lot of work. I mean, this is not for people that are looking for quick fix, magic pill
Right.
potion stuff. This is the
Oh
people that are
yeah.
serious about getting healthy.
Yeah, yeah, absolutely. So for listeners who are like, all right, I'm on board, but obviously the long-term water fast is not going to be appropriate for somebody who might want to do a little bit of fasting on their own, but they haven't done
Mhm.
it before. Do you have any advice for how to begin?
Yes.
Okay.
I think everybody should fast on their own at home for 12 to 16 hours every day. So that
Mm-hmm.
means they should not be eating 3 to 4 hours before they get to bed at night. And if they're trying to lose weight, they might extend that by doing some exercise in the morning before they have breakfast.
Mm-hmm.
That could give them up to 16 hours of fasting every day after day after day after day after day. Cumulatively, that has a huge effect. Now, if they want to extend that, then they're going to want to work with their medical doctor, their naturopath, their chiropractor, somebody that can review their history, examine lab, make sure they're appropriate candidate, get appropriate baseline lab, make sure they're in a resting state, and make provisions for appropriate refeeding.
Mm-hmm.
Because too rapid a recovery to feeding after fasting can lead to post-fasting edema or refeeding syndrome. It can be a very serious problem. So if you're going to do a longer fast, make sure you're the right person and you're doing it right.
Right.
We review all of that, both for the patient and for physicians in our book, Can Fasting Save Your Life?
Mm-hmm.
It's written at a relatively high level, so a physician would have the resources to evaluate what kind of screening needs to be done, what are they worried about. If they go through that book, they'll have a good idea of how to help their patients through that process.
Mm-hmm.
But I wouldn't recommend people do long-term water fasting without having gone through the
Right.
process of history exam, lab, and monitoring.
Right. Yeah, absolutely. And then so
Now,
you,
modified fasting, like Dr. Longo recommends, may be able to be done more safely
mm-hmm.
for people on their own. And so, you can follow his protocols when it comes to intermittent fasting.
Mm-hmm.
For people that have the benefit of naturopathic physicians, they're usually well versed in all of the different alternatives that are available for outpatient care. For water fasting, though, that's really something that's going to be done for most people, best done in an inpatient setting where they can get the kind of rest and medical supervision that they need.
Sure, yeah. And you alluded to the challenge of reintroducing food on the other end. So for some people that like, let's say for the patients that come to you and do the longer term water fast, and then
Yes,
you slowly reintroduce the foods and you send them on their way,
yes,
what kinds of instructions do they have on the other end of how to
right.
maintain this?
Well, they're going to be at this facility half the length of the fast. So a 20-day fast, they will
Okay.
be under direct supervision for 10 days. It
Mhm.
takes half the length of the fast to get back to an unrestricted whole plant food SOS-free diet.
Yeah.
So we're trying to get everybody eating a whole plant food SOS-free diet anyway. And
Mhm.
so during that recovery period where we start with juices and then go with raw fruits and vegetables and then steamed vegetables and starchy vegetables and that gradual recovery,
Yeah.
that's done in an inpatient setting.
Okay.
That's done if they're doing it at home in conjunction with their doctor. That's done before they go back to work and before
Right.
they're
Right. Right.
engaging in all the activity. So
Hmm.
Half the length of the fast is a general rule. Some people can be a little bit quicker. Some people take a little bit more, but generally that's a pretty good rule. So if you have a 2-week fast, you got to plan another week of recovery feeding.
Yeah. Okay. And then on the other end, though, in terms of people who are just trying to maintain this, you see them a year later, and hopefully they've managed to maintain the benefits that they've gotten. This is just what kinds of instructions, like, is there, it sounds like you're vegetarian based, primarily
So we're
vegan.
recommending a whole plant food diet. So
Okay.
fruits, vegetables, grains, legumes, nuts, and seeds,
Okay.
and free of added SOS. SOS is the international symbol of danger, and it stands for the chemicals that fool the satiety mechanisms in your brain and leads you to
Okay.
overeating, which leads to the fat and the visceral fat and the
Got it.
disease.
Yeah.
And
Yeah.
that's salt, oil, and sugar. So we're eating
Oh,
a whole
okay.
plant food diet that's free of
Okay.
salt, added salt, oil, and sugar.
Sure.
So no meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. Basically, anything that gives you joy or comfort, we're going to remove.
Well, that's a good selling point. Nice. And with instructions in terms of like reintroducing exercise activity, I'm assuming like during the fast they're not doing a lot. What kind of process do you have for them to reintroduce activity on the other end?
By the time we're half the length of the fast recovery, they begin gradual recovery of activity. Now, depending on how conditioned they are or deconditioned. So
Sure.
we start with walking, hiking, biking, swimming, stretching. We like a variety of activity if possible. So, I mean, I wish I practiced what I preach. I play basketball. I play basketball vigorously 4 times a week. I should be doing more, a variety of stuff, but we recommend some walking, some hiking, some biking, some swimming, some dancing, so that we don't get overuse injuries
Variety,
and we
sure.
don't get difficulties. So that depends on the individual. And again, sometimes people have debilities that they have to compensate.
Of course.
Maybe they've had some degenerative knees. They're not going to be running, but they might be able to do a stationary bike, or they might be able to do, other types of things. But the idea is a variety of things that build flexibility, strength,
Sure.
balance, and aerobic conditioning.
Yeah.
And exercise is really important. If you don't use it, you really do lose it. There's
Hmm.
only a few things that matter. Diet, we
Hmm.
recommend a whole plant food diet.
Hmm.
Exercise, we recommend a variety of activities.
Hmm.
And sleep.
Hmm.
So we recommend people get enough sleep that they can wake spontaneously feeling refreshed.
Hmm.
And that's going to be 7, 8 hours of sleep. It's not going to be 4 hours of sleep and take a bunch of coffee to get by.
Yeah,
And
seriously.
so if you do the diet, sleep, and exercise, and then we recommend fasting every day for
Hmm.
12 to 16 hours,
Sure.
and then
Yeah.
maybe occasionally you do a longer fast.
Right.
And we actually think that the people that get the most benefit of fasting are actually healthy people using shorter fasting preventatively. And we
Hmm.
actually did a study where we looked at cardiometabolic changes in sick people, and they were profound. But proportionally, they were actually more profound in healthy people even than the sick people. And
Hmm.
that may be who gets the best benefit of the occasional 5, 10 day fast is the healthy person that's using it before they fall apart instead of waiting
Right.
until they're in trouble.
Yeah, absolutely. Makes sense. So, what have I not asked you that you want to make sure you leave with our audience?
Well, you've asked me a pretty broad range, but the big concept is health results from healthful living. Focus on healthy living. If
Okay.
fasting might be helpful to help facilitate you, read our book, Can Fasting Save Your Life? And give us a call if you want a free phone conversation with me to help you decide whether or not that might be appropriate for you.
Yep. And so, how would people find your number, website, all of that? Where can they learn
They
more
go
about?
to TrueNorthHealth.com.
Yep.
They will get more information than they probably want. We also offer a lot of educational materials. We offer our lectures that we stream at the center. We do that. That's free. It's not monetized. We have a Roku channel that's not monetized where they can get access to our recorded materials, our written materials. We have 2 great books, The
Mhm.
Pleasure Trap, our original book, and Can Fasting Save Your Life?
Awesome. Well, I will link to all of that in the show notes. And thank you, Dr. Goldhamer. This has been great.
It's my pleasure.